So the final piece we're going to talk about, the final systems we're going to talk about are urinary and bowel. Um, how do we prevent complications and elimination due to immobility? For the urinary system, one of the primary complications is urinary calculi, kidney stones. So we want to make sure that we monitor that patient's calcium level and make sure they're well hydrated. Also, UTI, we want to make sure we get those catheters out as soon as they're no longer needed. We want to encourage our patient to void fully and to void frequently enough that they don't have urine sitting in the bladder for days and for hours and hours. Um, Sometimes patients who have decreased immobility will limit their fluid intake because they don't want to have to go to the bathroom as often. So we want to make sure that we're educating our patients about getting adequate fluid. As for constipation, again, fluid intake is a major factor, making sure that patient gets fiber if they're able to eat, um, stool softeners as needed. A lot of times patients who don't normally need stool softeners need them when they're immobilized by an illness or some kind of surgery. Remember that the reason for the immobility may also contribute to those complications. If that patient, to prevent fecal impaction, we want to treat constipation promptly. So if that patient gets constipated, we don't want to wait for 2 or 3 days and see if it works itself out. We want to begin addressing the constipation so that they don't become impacted. Okay, that's the end of this lecture. It is shorter, but it's really important to put all of these different pieces together because a lot of the complications of illness that we see in patients are connected to immobility caused either by the illness or by the treatment that we're doing for that.